Okay. We have these. We're going to keep these down here in the Cath Lab. They're going to be in the back hallway.
Okay.
On one of our bins back there.
Back where you have the patients, the patient waiting area there.
So down around the corner. So next to where those windows are at, you'll see the bins in there. Yep. All right. So it comes out, and basically it's going to be just like a Femostop belt. Get this side appropriate that we are going to do to aim this up. All right. So this is all kind of aseptic technique. So we're going to roll the patient like we normally would, and then roll it through. Pretty close. And we want to put on the furthest side. So just like a Femostop belt, the corner. And we kind of get it adjusted how we want. We want the furthest side kind of canted down just a little bit, and I'll show you why. So this is going to be in its own separate little pouch. So it's sterile. So a pair of gloves on as we go to pull the sheath. So what we want to do is, if you're going to pull the sheath, or where the skin nick is, we want to put it to the outside radius of where this is going to go at. What that's going to ensure is you're going to ensure that this post is directly above where the arteriotomy is. So if you can imagine that the skin nick is kind of right out here to the outside part of that. Manual pressure down.
I'm down in Cath Lab right now. Let me come back up. I'll talk to you. Okay, bye.
And again, get this started. And it's manual pressure straight down.
Adjust.
Yep. And then pull the belt tight. So when you let up, or if you're pulling the sheath, you're pushing down, you pull your sheath, you should have enough direct manual pressure that you should have hemostasis. Pull the side tight, and then if you need to, you can increase pressure by simply turning the stop. Once you turn this, make sure that there's no hematoma coming, there's no active blood flow, you should be good to go. Pedal pulses, of course, we want to double check. If you start to get a news, you can simply adjust it by turning it down. So if there's any questions, up here it says increase, decrease. Increase means you're increasing the pressure, you're pushing it down. Decrease is as we're slowly coming up according to the Providence protocol.
So are these going to take the place of the manual pressure after you pull the sheath?
Right. That would be dependent on your departments. For us, we're going to do manual pressure and only use this if we have to do a bleeding or hematoma afterwards. Correct. So
I just wanted to make sure it wasn't something that it was going to be required that we do this.
No, but if you feel more comfortable doing this in the future, I don't know what you guys would recommend. Maybe you can talk to your, manager up there and see what's going on. Maybe easier. I don't know. And from the Cath Lab, I'm gonna say manual pressure for me is always gonna be my first go-to.
Mine too. Yeah.
And then when you decrease this per protocol, you want to slowly come down on the pressure by turning it to the decrease way, so counterclockwise. Once you hit that 15-20 minute mark, it's recommended that you go ahead and just leave this on here for another 5 minutes.
Okay.
Okay.
Why not?
In case why not? If you have another bleed or something comes up, the patient coughs, starts to lift the leg, now you can manually push down, increase your pressure back.
Yep, sounds good.
Okay, so now we got all the way down to the end, 20-25 minutes, we're good to go. What they recommend from the manufacturer is to take this off simultaneously. So by lifting straight up.
Makes sense, and you don't roll.
So just in case you don't accidentally pop the, which you have, the cloth that you have there on controlling that pressure. Fairly simple device. This piece right here, the metal piece, is what we want to save. All the rest of this stuff is disposable. Sandy wipe to wipe it down. And what they recommend is turning this with the sandy wipe here. Make sure it gets nice and clean. They want to focus on this area that's closest to the patient, that's going to be bloodiest, and of course then you wipe down the whole device. So if you had to actually remove a sheath, you can actually press down manual pressure, pull the sheath, and then while you have manual pressure, now you adjust this other side. So that should stay in the spot where you put it at. You start to ooze or you got some bleeding that you need to do, you can twist clockwise. You're increasing the manual pressure, or they're increasing the mechanical pressure directly down onto, hopefully on top of the arteriotomy. That's what we're aiming for. And then as we get going, decrease, decrease, you get to the point of you're ready to take it off, everything looks good. What they recommend is clicking both tabs and then lifting straight up.